one of the things that is easy to forget about or to mistake is this idea of irregular intake. So, some people might think if I just don't take my medication today, then I miss out on a day of medication. But in some cases, it can actually be more problematic than that. So we've got a theoretical drug here, and you can see the green line, that wavy line, is the actual amount of the drug that's in the bloodstream. And you can see the horizontal green line here is where the doctor wants the medication to be. That's the therapeutic level they want. Let's just say, for the sake of example, that this is a once-a-day medication, which is fairly common for a lot of the antidepressants nowadays. And you can see the first 4 days in this graph, the person is taking the medication and they're hovering around that therapeutic level. So that's exactly what the prescriber wants in this example. Now, on day 5, you can see they stop taking, or they forget to take it, or decide not to take it. For whatever reason, they don't take a dose on day 5. And you can see that the body doesn't stop metabolizing the drug just because you've stopped taking it, right? It continues to break the drug that's in the bloodstream down and excrete it. And so you can see here, because even though the person's only missed day 5 and day 6, if you look at what's happened to their blood levels of the medication, you can see that they've actually missed 1, 2, 3, 4, 5.5 days. Even though they've only missed 2 days of medication, they've moved out of the therapeutic level for 5 days. And you can see similar kind of thing happens later on when they miss another dose. So this is why, this is just one of the many reasons why it's important, that people take a medication as directed by their prescriber, because it can have unexpected kind of effects when they're not taken properly.